They call me Squirrel.
What's going on, Squirrel Squad? It's your boy, the Squirrel. Today I'm looking at how the United Kingdom's healthcare system works. Now I'm going to give you an idea of how I think it works. And this is from what people have told me, what I've seen in other videos, and in the recent videos I did about what Americans think UK healthcare costs, which really didn't actually cover that. But to my knowledge, and from what I've, you guys are always educating me and helping me out, and I believe that what happens is you pay a higher tax, and then that tax helps pay for nationalized healthcare for the whole country. You can get private insurance if you want to, but that's basic gist of what I know of it. Let's check this out. I want to see anything's better than what we're doing. There we go. It's time. This is like I said, it's the United Kingdom healthcare system and how it works. You ready? I'm ready. Let's do it. I didn't hit the right button. It's like smacking. Oh, yeah, hey, let's do it. Nothing. I should even check the volume. Oh, see, the volume is not up. See? It's a good thing I checked.
Super Tuesday came and went, and the Democratic presidential race is narrowing to two very different candidates. Far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to show us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for all will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than any other developed country. There's one country that spends less than half what the U.S. does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming?
Another problem I think that we have, and this is just me, I'm just speculating, but I think this is the biggest part of the problem from everything I've read and heard. And that's that our politicians are bought by the drug companies. So if the drug company is buying the politicians, we're totally screwed. Everything costs more money because they just soak up. These people are making trillions of dollars off us being sick. Sad. So sad. And the politicians won't do a damn thing for us because the pharmacy companies line their pockets.
In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US, and the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system. So everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his
You know, it's funny. I've heard people say that, like, oh, they tax us for this, and I'm sure they do. They tax the hell out of us over here. They tax us huge. My paycheck is ridiculously taxed. When you look at how much money the government takes out of me every week, like, taxation is complete theft. For what my government does for us, I mean, yeah, sure, if you want to say, well, take all the planes and tanks, and yeah, okay, that's great, but we're sending those to other countries anyway, so. But I get that security is part of it and all that. I understand that it costs money to keep us safe, and I get all that. But I mean, our government fucked up our healthcare, and they still take a ton of money from us. I don't know what, I'll have to look up and see what percentage of your paycheck goes in taxes. Maybe someone could tell me in the comments, like it's 30%, 40%, whatever. For us, it's right about 33%. If you pay a state tax, because some taxes have state tax as well, state I live in, and that's more. So like almost 40% of my check goes in taxes. It's pretty sad, really. For not having any health care for it anyway, it's sad.
Comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I would call that socialized medicine. Government provides the care. Government pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
Oh, yeah.
If the NHS, if that's socialized medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only...
I honest to God know 2 people currently, probably more, but 2 people that I know of that have this problem, that they miss their meds for days at a time when they go to refill because they can't afford the refill, and they have to wait till they raise the money to get the refill because the stuff they're getting, like one of my friends, it's $200 a month is what his prescription costs. And it's insulin he has to have. He's type 1 diabetic, and it's the kind of insulin that he has to have, and it's ridiculous. And then another friend of mine, it's a prescription that he takes. It's for his heart, I believe, and it's over $200 a month for his as well. So that's a big cost. It's a big expense, and sometimes you have to wait and miss your meds for a couple days because you just don't have the cash, waiting for your next check, whatever it may be. With the cost of everything around the world, gas and food, especially around the world, going up, everybody's kind of squeezing a little tighter. It's tough.
Publicly funded. The government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Center for Freedom at the Heritage Foundation.
Did they get, was that like a plug for the MacBook Pro? They were like, if we put this on and instead of, see how they got them on full screen right here? Because like I was like, why didn't they just do this? This is like a really weird thing right here. Instead, they got the CNBC cup. They get their logo. They get it, the cup here, and then of course up here, some fake plants. That's lovely. But why are we watching this on a computer? Is it an ad for the MacBook Pro? Is that what we're doing? I just don't understand why this shot just doesn't make any sense. Sorry, I know it just has nothing to do with the healthcare. These things drive me insane. I don't even know why this is a stupid shot.
That's Niall Gardner. He's the director of the Thatcher Center for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff. It takes it from the NHS. It cherry picks, takes the low-risk patients, not the high-risk patients.
I'm learning a lot more about the NHS and how this all works than I was expecting to. This guy's really getting deep into the inner workings of it, you know. This is really actually interesting. There's a lot more to this than I thought.
Patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
The problem is that the NHS is already on the table. It has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in the trade deal, then let's see legislation that sets that out so it's cast in stone. And they haven't rushed to do that.
Trade negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations, and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK
someone sent this over me to watch, and I'm just wondering if there's like I guess that there's really not much difference in I was going to say if one does is like a newer one, because this was talking about Bernie and Joe back for the election. Boris is still in, Trump's over there running his mouth. This is 3 to 4 years old, all these, like when this happened. So I'm just wondering, but I suppose if nothing's changed, it's still running the same, and that's what we're here to learn is, how it works. So I guess that part's not different, but look at how political it's all getting. It's just, that's and politicians can fuck anything up.
Regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest.
This guy. Never mind, but this guy.
Just part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
Britishness, I like that word. Britishness, that's good. But she had a lot of good information as well. Everybody in that video had a lot of good information, even that one guy. But it's obviously a better system than we have. It's too bad that politics are trying to screw your system up too, because politics definitely screwed ours up. We all know what happened over here. You can keep your own doctor. You don't have to worry about nothing. Nothing's going to change. We were all fed that big fat lie, that big plate of crap. But either way, it's whatever. It is what it is. We're all dealing with it together over here. It's not just me. It's everybody. Everybody's dealing with the same crappy healthcare system that we have. And I'm glad to see that you folks have a great system over in the UK. It seems like a great system. I know you got to wait a little longer. And I definitely know there's people on both sides and how they feel, if it's good or if it's bad. I know that. I've seen it in the comment section. I've heard people talk about it. Overall, though, I know that people are afraid of socialism because of Venezuela and stuff like that. And if you have a tyrannical government, socialism is horrible. But as far as healthcare goes, socialized medicine, I think, is a win for everybody, and I think it's something that should happen. I think it's something that everybody should at least have the right to have healthcare and be able to seek services and not worry about if it's going to put them in the poorhouse. You know what I'm saying? So, my 2 cents. Listen, I learned a lot from that. I really did. I learned a lot about the politicalization of healthcare, even in the UK. A lot more about how it works, the private sector, and the general practitioners and things like that, which I didn't know about all that. So, kind of neat. I appreciate you watching along. Please feel free to educate me any more than you like to down in the comments below. If you don't like some of my comments, please, by all means, let me know what you did and didn't like. It's okay. I just try to be honest with you, and you're welcome to rebut me in the comments section all you want. That's fine. That's what this is about. It's about having discourse and us learning together. So I hope you enjoyed it, and I will catch up with you soon, I guess. I hope you all have a great weekend, all right? Take care of yourselves. Be good. Squirrel out.